Hi, I'm Dr. Aimie, and this is the next video in the Trauma in My Body series, where we've been talking about the effects on our health of past traumas and certainly accumulated stress. And this really comes back to the nervous system, and the nervous system directly influences our immune system. And so our immune system can get out of hand, and we know, and certainly in the last blog we talked about how the inflammation is centered most in our gut, in our brains, and then any imbalances in our immune system where it may be even attacking our own cells or causing food sensitivities, being more reactive to things than what they should be, and more than what is necessary. So I wanted to go over a few specific things that you can do if you have a history of past trauma, or if you have been under chronic stress or feel that your body has a large burden of stress on it, and some specific things that you can do. So when we're looking at the gut, what I tend to use a lot is the activated charcoal. And this just binds up everything that's in the gut. So especially if you're feeling bloated, feeling gassy, that's going to help. And if you want to reduce the overall inflammation in your gut but aren't necessarily feeling gassy and bloated, then some great things that you can use are turmeric. And you can either buy capsules and take more pills, or you can also buy the spice turmeric or curcumin and just take lots of it and add it to your food when you're cooking. And those are pretty powerful anti-inflammatories for the gut and for the body overall. The next thing might surprise you because it's not known to be anti-inflammatory, and that's going to be vitamin D. And the D that you want to get is D3 rather than D1 or D2, and that's the form that your body needs in its last stage of conversion. And vitamin D3 has been shown to directly reduce inflammation in your gut. How much you should take is a tough question. I take a lot more than what any medical journal or other physician would ever recommend. But then I've done my genetic studies through 23andMe, and I know that I have the genes that don't absorb vitamin D very well. And so I track my vitamin D levels, and I take large amounts, and then I measure my blood levels every 3 to 4 months to make sure that I'm not getting out of range and going too much, and am going to be concerned about overdosing on vitamin D. If you're not able to do those genetic tests, or you're not able to track your vitamin D levels, what is safe and has been studied by the Mayo Clinic is 10,000 IUs, or international units, of vitamin D3 daily. This is much more than the daily recommended amount by the government, but it's been proven 100% safe by the Mayo Clinic at that amount. So I would recommend that amount for everybody. Even if you don't know if your levels are low yet, taking 10,000 IUs a day is not going to hurt you and could only benefit you in terms of both inflammation and all the other processes that vitamin D is involved in. And then if you're looking at reducing the inflammation in your brain specifically, the best thing out there is going to be what is called NAC, or N-acetylcysteine. And this is a supplement that is actually used in the hospitals for when people overdose on Tylenol. And it does stimulate the liver's detoxification system, and that's how it helps a person get through a Tylenol overdose, since Tylenol is metabolized by the liver. But in the studies, especially looking at substance use, drug addictions, N-acetylcysteine has been shown to reduce the inflammation in the brain. And yes, this is still likely going through the process of the liver detoxification system, but we do have those brain imaging studies that show that N-acetylcysteine reduces the inflammation in the brain. So if you're experiencing any kind of mood disorder, depression, anxiety, insomnia, PTSD, and certainly any kind of substance use that's going to be associated with inflammation in your brain, I would take it. And the dose that you're looking at is somewhere around 2,400 milligrams every day. Now, just for general anti-inflammatory and optimizing your immune system, there are a couple of things that you can do as well. Similar to the N-acetylcysteine is going to be the liposomal glutathione. And this is going to also boost your liver's detoxification system, since glutathione is the main enzyme in that liver detoxification system. And so you do need to take the liposomal form in order to actually get it past the stomach acid and get it absorbed in the form that you need, that your body can use it. But it's great in reducing overall inflammation, overall toxin burden, and it will help clear out your whole body. There have been some pretty amazing studies looking at the effects of taking this glutathione and the prevention of even diseases like tuberculosis in people who were exposed to it. So we know that it is effective, and we know that helping that liver detoxification system can play a huge role in helping the immune system and optimizing it, getting it to the right balance where it's attacking what it's supposed to be attacking and not attacking what it is not supposed to be attacking. The other thing that is kind of for general inflammation is resveratrol. This is the same component that's in the red wine. And so for various reasons, the capsule form of that might be better than the actual alcohol in 1 glass of red wine daily for some people. And then for the last one that I'm going to recommend is by far one of the most powerful. And this is vitamin C. And generally we leave vitamin C for when we're feeling sick, when we have a cold, and we take emergency or some other form of vitamin C that really actually doesn't give us that much. Or maybe we think that it's that much because we usually don't take any. And Linus Pauling was a doctor who contributed a lot to the field of medicine and science. And the immune system was one of the things that he looked at and studied. For him personally, he got up to taking 90,000 milligrams of vitamin C every day. I've only gotten myself up to taking 10,000 milligrams of vitamin C every day. And there's lots of other people who have also started to take what would be considered very large doses of vitamin C every day, because it's not dangerous to your system if you take too much. You're just going to pee out the excess, but it creates such a powerful resource and foundation for the inflammatory and immune response in your body. And so if you take too much, especially more than what your body is used to at first, it can give you loose stools. So warning, that may happen. But then if you're constipated, that may be one of the benefits of taking a large amount of vitamin C, and that's commonly called a vitamin C flush. But if you're using it for just your overall health and your immune system and have a history of trauma or stress, then vitamin C is going to be one of the most important ones that I can recommend to you. And get up to as much as you can. Like I said, if you're taking too much, you're just going to pee it out, and it's not going to give you any negative side effects. And so get up to as much as you can. I would say certainly if you're taking anything more than 3,000 to 4,000 milligrams of vitamin C every day, then you're probably going to be near optimal levels for what your body needs in all of its processes. There are lots of other anti-inflammatory things out there, the polyphenols, and certainly other supplements and herbs, and all can play a role. These are just some of the most powerful ones that are in the literature and that I have used for myself, and so they are tested and tried, and I know for sure that they work. So I hope this has been helpful, and certainly if you have any questions, I'm more than happy to answer, and we'll keep working on getting our bodies better and healthier after trauma and stress.